expect when it gets treated or managed? So to tell us more on the issue, I have in the studio three experts. I'm very happy to welcome Professor Dr. G.C. Khilnani from the Department of Medicine at the All India Institute of Medical Sciences. Sitting next to him is Associate Professor Dr. Tanmay Talukdar, Department of Medicine, Lady Haring Medical College. And to my left, I have Dr. Balakrishnan Menon from the Department of Respiratory Allergy and Applied Immunology at the Patel Chest Institute. So I take this opportunity of welcoming all three of you to the show. Well, friends, before we get into the details of finding out about asthma, let's take a look at this report, which will give us a fair idea as to what asthma is really all about. And after that, the doctors can help us to explain this further. So let's take a look. Asthma is a when we talk of asthma.
This was quite a good clip that you showed. But asthma, besides being a chronic disease, should be treated as a tendency.
Okay.
Meaning thereby something like 6 to 15% of children, and if you talk about adults, something like 3 to 10% of adults, they have a tendency towards asthma. And of course, we all understand that asthma is characterized by episodic shortness of breath, breathing difficulty, there is wheezing, there is cough. And when we say that there is 3 to 10% adults have tendency to asthma, it does not mean that this percentage of people are wheezing or coughing. That means these people have their airways or bronchi which are hyperreactive. So whenever there are adverse circumstances, which could be exposure to some noxious substances, to smoke, or say for instance viral infection, or some mites or pollens or dust or change of weather, change of temperature, or even emotional stress, can trigger, and that culminates into an attack of asthma, as described, cough, shortness of breath, be it a sports or be it professional excellence.
Okay. I think you really summed it up pretty well, but now let's go step by step really. So Dr. Tanmay, when we look at the burden of asthma in our country, over the years, what are the kind of trends that you've seen? Has it been on a rise, or is it controlled, or is it going down in certain pockets?
It's actually an interesting scenario as far as the prevalence of asthma is concerned, but put it very simply, the more the developed country, asthma is little more there. Less the developed or developing countries, asthma is less.
Okay,
but
so now, what is the reason for that?
Globalization and urbanization, however, has been changing this.
Right.
So the prevalence of asthma has been rising in countries in Asia, Africa, Latin America. Slowly it's been rising. But the issue is it's very varied. In fact, some countries may have even 1%, some would go up to even 18%. So the prevalence varies from place to place. Urban areas, relatively more than rural areas, more close to a pollution pocket, one person stays, asthma prevalence is more. But then, and not only that, it varies from age. Children have more prevalence of asthma. As one grows old, the prevalence does fall down a bit. So it's a varied prevalence all around. And the issue is that problem, and it is rising.
Usually, later on it may become chronic. So generally a person presents with episode of cough.
Okay.
There is wheezing. Wheezing is a whistling sound which comes from the chest, which can be heard by not only by the patient but also by a person who is beside or who is in the room. It is also has a breathing difficulty. The person is unable to breathe. Quite often they have to sit up through the night because they are unable to lie down. And most importantly, that it is short-lived. It lasts for a few hours or few days. If you treat it effectively, which we will discuss later, if you give inhalers, short-acting inhalers, it responds within minutes. And this is one of the characteristics of asthma. There are breathing difficulties
which may be self-limiting, and they may just be episodes initially. And if you go to a doctor and the doctor is able to diagnose well, then for all you know, you could be on the way to recovery. Well, all that, other things that we are going to discuss will come after this break, so don't go away as we are coming back very quickly.
Doesn't do the test properly, you're not going to get results properly. That's one thing which should be very clear to the patients, that when they go in for a spirometry, they'll have to perform their best. So they'll be usually asked to take a deep breath and blow into the machine, and a variety of parameters are measured in that, and that is a simple spirometry test which is done. There are of course some other tests which can be added on to it, which may be needed in some situations, but asthmatic attacks, a patient of asthma can be diagnosed by a simple spirometry test, which is followed by giving a bronchodilator and doing the spirometry again, and seeing what changes have occurred in those parameters which were measured. So that's how asthmatic attack is, asthma is diagnosed, and 12% change is nowadays accepted as positive for bronchial asthma in some of the parameters.
All right, okay. Now, Dr. Khilnani, we just saw the clipping on the triggers. So now I want to talk about the risk that the smokers really have, because once they are smoking, I'm sure they are more susceptible to the disease. So can you just tell as to what really happens in these patients if a person who is a smoker also has symptoms of asthma?
Any kind of noxious fumes which go into the respiratory system, as I said at the outset, that it is a hyperreactivity of the airways
Right, right.
to anything adverse.